Welcome to this presentation of the Fujifilm Lisendo 880LS EV, our premium cardiovascular ultrasound system. In the following sections, we'll explore its advanced cardiac imaging capabilities, seamless workflow, transducer technology, and how it supports your clinical applications with precision and confidence. The Lisendo 880LS redefines cardiovascular ultrasound with exceptional image quality, precise blood flow visualization, and rapid 3D rendering. Designed to support confident diagnosis and treatment of cardiac disease, it offers comprehensive tools for every clinical need, bringing diagnostic imaging without compromise to your daily practice. 3 core innovations drive the Lisendo 880LS forward: pure image, your application, and seamless workflow. These pillars address the cardiologist's daily needs for superior image quality, clinical flexibility, and intuitive usability. Each feature is designed to help you reach the next level of diagnostic precision and confidence. The Lisendo 880LS features cutting-edge CMUT technology, with a wide 2 to 22 MHz bandwidth. This single-probe solution delivers crystal-clear images, adapts across body types, and boosts productivity, all while being robust and cost-effective. It's high-frequency imaging, redefined. True wideband, true power, and true waveform define the imaging power of Lisendo 880LS. With CMUT technology at its core, the system delivers a super wide frequency bandwidth and high sensitivity across various patient types. A full suite of advanced modalities is available through a single, robust probe, offering consistent performance, clinical versatility, and unmatched convenience in every exam. The Lisendo 880LS supports advanced cardiac imaging with its 3D transesophageal transducer. This technology allows real-time, volumetric visualization of cardiac structures from the esophagus, providing detailed assessment of valves, septa, and chambers. It is especially valuable during interventional procedures, where precise anatomical insight is critical for clinical decision-making and patient outcomes. Acquired 3D data can be used with specialized analysis packages to extract clinical metrics with precision. From valve diameter measurement to morphological observation and volume tracking, Lisendo's 3D quantification suite delivers critical information for cardiac evaluation and surgical planning. The Lisendo 880LS supports robust 3D quantification across a variety of cardiac structures. Automated and semi-automated tools simplify volume analysis, enabling efficient workflow and consistent, reproducible results. Our single crystal 3D matrix transducer enables clear, real-time visualization of cardiac anatomy, enhancing structural heart assessment in every dimension. Designed for daily clinical use, this 3D matrix probe streamlines advanced echo acquisition. Its lightweight, ergonomic design allows for comfortable scanning, while delivering superb spatial and temporal resolution even in difficult-to-image patients. With our EF, fully automatic acquisition and ejection fraction measurements are just 2 clicks away. Using 3D TTE, the Lisendo 880LS quickly calculates volume and EF values, simplifying workflows and reducing operator dependency. Lisendo 880LS pure symphonic architecture harmonizes transducer, front-end beamformer, back-end processing, and a premium OLED display. This synergy elevates image clarity, contrast, and consistency, helping you reach the next level in cardiac diagnosis. The variable beamformer enables outstanding image clarity from near to far field. Fast parallel beamforming improves lateral resolution and SN ratio, while e-focusing enhances penetration and reduces focus dependency for consistently clear images at every depth. E-focusing dynamically adjusts the focus during transmission and reception. This next-gen beamforming technique collects signals across the image field and merges them to produce uniform, high-contrast images, improving both sensitivity and resolution throughout the scan. The system features a premium 22-inch OLED display. This self-luminous panel delivers true blacks and exceptional contrast resolution, making even subtle grayscale differences easy to detect. It's an ideal match for high-precision diagnostic imaging. The Lisendo 880 features advanced piezoelectric single crystal technology across both convex and sector probes. These materials produce ultrasound waves with greater sensitivity and wider bandwidth, translating into exceptional image clarity, even in deeper structures. Designed for comfort and efficiency, the Lisendo 880 integrates ergonomic features such as a flexible OLED monitor arm, double wheel casters, and a 10.4-inch touch panel. These innovations contribute to both patient and operator comfort, making every examination smoother and faster. The large touchscreen allows intuitive adjustments for imaging, measurements, and presets. A two-way multi-rotary encoder reduces hand movement, while the centrally placed palm rest provides ergonomic support, helping reduce strain during long procedures. The monitor and console offer a wide range of motion to maintain operator comfort throughout long examinations. Convenient storage for gel, media, and supplies improves workflow efficiency. Combined with automated protocols, these design elements support a highly productive workflow. Lisendo 880 introduces hemodynamic structural intelligence, or HDSI, a suite of smart automation tools that enhance diagnostic precision and boost throughput. It brings high precision to automated cardiac evaluations, improving clinical consistency. Hemodynamic structural intelligence technology simplifies cardiac exams with automated anatomical and functional measurements. It detects end-diastolic and end-systolic frames, calculates left and right atrial and ventricular volumes, ejection fraction in both two-dimensional and M mode, and supports Doppler cursor positioning and protocol guidance, ensuring a smooth and efficient workflow from start to finish. Hemodynamic structural intelligence offers a powerful, automated cardiac measurement package that enhances both speed and accuracy. By combining artificial intelligence with big data, it delivers consistent and precise results for volumes, ejection fraction, and strain. With just one click, key values like global longitudinal strain and chamber volumes are generated in under 8 seconds, cutting exam time by nearly 50%. With the IEF package, end-diastolic and end-systolic frames are automatically detected, enabling quick and precise EF measurements. The entire EDES detection process can be done with just 2 clicks, delivering up to 20 times faster workflow compared to manual methods. Understanding cardiovascular performance requires more than structure. It requires insight into flow dynamics. HD analytics includes tools like LVE flow, dual gate Doppler, eTracking, and vector flow mapping to provide a complete picture of heart function and failure risk. LVE flow is a non-invasive, high-definition flow imaging mode designed to improve visualization of the endocardial border. It offers higher spatial and temporal resolution than conventional methods, helping turn difficult cases into diagnostic quality studies without the need for contrast agents. LVE flow has shown excellent clinical agreement with contrast echocardiography. Studies report 94% of endocardial segments were clearly defined using LVE flow, with acquisition times reduced by over 80%. This demonstrates LVE flow's potential as a first-line tool for assessing left ventricular function, with high clarity and efficiency. Validation against cardiac MRI confirms the reliability of LVE flow in measuring left ventricular volume and function. Despite slightly higher EDV values, LVE flow demonstrated strong correlation with MRI and traditional LVO, reinforcing its use as a non-invasive, accurate, and efficient tool in cardiac evaluation. LVE flow supports a wide range of clinical applications, including evaluation of left ventricular opacification, mitral regurgitation, and intracardiac shunts. Its versatility allows it to replace or complement more invasive imaging methods in daily cardiology practice. Using LVF flow, clinicians can clearly visualize shunt flows within the heart, enhancing diagnostic confidence in cases such as atrial or ventricular septal defects. This high-resolution imaging method supports rapid decision-making during both routine and emergency evaluations. Vector flow mapping, or VFM, provides a new layer of insight into intraventricular hemodynamics. With visualized velocity vectors, it reveals wall shear stress, relative pressure gradients, and energy loss. These metrics can assist in early heart failure detection and in understanding the effects of structural abnormalities during systole. Vector flow mapping provides non-angle-dependent velocity data, offering new insights into cardiac performance. It helps visualize vortex flow, energy loss, and relative pressure, especially useful in evaluating valve disease and post-surgical outcomes. Studies confirm its strong correlation with cardiac MRI, and a pressure gradient cutoff below 0.5 mm of mercury helps identify heart failure with preserved ejection fraction. VFM is ideal for evaluating flow dynamics following mitral valve surgery, whether anatomical or anti-anatomical replacement, plasty, or use of bioprosthetic valves. Visualization of altered vortex patterns post-intervention can provide clues to optimize surgical outcomes and long-term patient management. Vector flow mapping helps visualize vortex direction in the left ventricle. After mitral valve surgery, counterclockwise flow increases cardiac workload and energy loss. Identifying and optimizing flow direction is crucial to improve cardiac efficiency. A validation study showed that VFM-derived pulmonary regurgitation ratio closely matches CMR results. By analyzing flow volume as area under the curve, VFM provides a non-invasive way to assess regurgitation severity and right ventricular volume. Vector flow mapping measures the relative pressure gradient from the mitral valve to the apex. In patients with heart failure, this pressure is significantly lower compared to those without. A threshold of 0.5 mm of mercury has proven effective in detecting heart failure, including cases with preserved ejection fraction, making it a valuable non-invasive tool for early assessment. Vector flow mapping offers a new perspective on cardiac function by visualizing flow direction and velocity within the heart. Unlike conventional Doppler imaging, it enables dynamic assessment of intracardiac vortices, supporting more precise evaluation of diastolic and systolic performance. Vector flow mapping combines two key technologies: color Doppler to capture unidirectional blood flow toward the probe, and speckle tracking to measure wall motion. By integrating these datasets and applying flow smoothing, VFM reconstructs a full vector field, offering a comprehensive view of intracardiac flow dynamics. Vector flow mapping with ultrasound delivers flow visualization similar to particle image velocimetry and 4D MRI, but with greater accessibility and speed. This makes it possible to assess intracardiac flow patterns in real time, without the complexity or cost of advanced MRI techniques, bringing powerful insights directly to the bedside. VFM reveals subtle flow patterns even during brief periods such as isovolumic contraction. During this phase, small vortices form near the ventricular wall, visible through directional streamlines and vector fields. These patterns help explain early pressure dynamics in the cardiac cycle. Vector flow mapping allows visualization of vorticity within the left ventricle, revealing the direction and strength of swirling blood flow. Counterclockwise vortices are shown as positive values, while clockwise flow appears negative. This information is essential for evaluating cardiac efficiency and detecting abnormal flow patterns. Vector flow mapping quantifies energy loss by analyzing flow turbulence within the heart. In a healthy ventricle, flow is smooth and energy efficient. In contrast, patients with dilated cardiomyopathy show disorganized flow patterns, resulting in greater energy loss. This makes VFM a valuable tool for assessing mechanical inefficiency in heart failure. Vortex circulation describes the rotational flow within a cardiac chamber. Stable and properly located vortices help maintain efficient blood ejection and filling. Abnormal vortex formation, however, may signal impaired ventricular function, guiding treatment decisions in heart failure management. VFM also visualizes intraventricular pressure gradients. Relative pressure maps show how pressure distributes within the ventricle during systole and diastole. These gradients offer insights into myocardial performance and stiffness, especially useful in heart failure with preserved ejection fraction. During the end of diastole and early diastolic filling, relative pressure differences drive passive blood flow into the left ventricle. In heart failure patients, these gradients may be reduced, indicating impaired filling mechanics. VFM provides a visual and quantitative way to monitor these changes. This case from Dr. Takehisa Ujima shows vortex patterns in a patient with dilated cardiomyopathy. Vector and streamline imaging reveal disrupted and inefficient flow, helping correlate imaging findings with symptoms and guide long-term management. In dilated cardiomyopathy, the left ventricle becomes enlarged and its ability to pump blood efficiently is reduced. Vector flow mapping reveals disrupted flow patterns and altered intraventricular pressure dynamics. These changes correlate with impaired cardiac function, offering clinicians a non-invasive way to assess disease severity and treatment response. Non-compaction of the left ventricle is characterized by deep trabeculations and abnormal myocardial architecture. Vector flow mapping reveals disturbed flow dynamics throughout the cardiac cycle, especially during late diastole, isovolumetric contraction, and systole, highlighting inefficient filling and ejection patterns associated with this rare cardiomyopathy. IDGD enables Doppler waveforms to be obtained from two locations within the same cardiac cycle, eliminating beat-to-beat variability. This allows for simultaneous assessment of mitral flow and mitral annulus motion, providing rapid and accurate measures like E and IVRT, even in patients with irregular heart rhythms. Dual-gate Doppler helps estimate left atrial pressure by comparing the onset timing of mitral annular displacement and transmitral flow. In patients with elevated LA pressure, mitral inflow begins earlier than annular emotion. This tool is invaluable before and after valve procedures such as TAVI. RR navigation supports IDGD by automatically identifying heartbeats with consistent intervals, essential for accurate diastolic function assessment, especially in arrhythmic patients. It selects optimal beats that reflect stable cardiac function for more reliable measurements. RR navigation improves reproducibility in patients with atrial fibrillation or arrhythmia. It ensures two Doppler sample points, like mitral inflow and annular emotion, are measured simultaneously in the same cardiac cycle. This approach is both fast and accurate, requiring only 5 seconds to calculate EE. Dual-gate Doppler allows simultaneous acquisition of pulsed wave Doppler and tissue Doppler imaging from two locations in the heart during the same cardiac cycle. This technique minimizes beat-to-beat variation and improves assessment of diastolic function, dysynchrony, and hemodynamic changes, making it highly useful for evaluating heart failure, arrhythmias, and atrial fibrillation. Evaluating diastolic function can be difficult in AF patients due to irregular RR intervals. Dual-gate Doppler simplifies this by capturing transmitral and mitral annular velocities in the same heartbeat, eliminating the need for averaging over multiple beats and enhancing diagnostic accuracy. In heart failure, E-wave timing may be delayed relative to E-wave. IDGD captures both waveforms simultaneously, offering valuable insight into ventricular compliance and delayed relaxation patterns seen in dilated cardiomyopathy. Using IDGD with PWPW configuration allows clinicians to measure isovolumetric contraction and relaxation times from the same cardiac cycle. These parameters are key in heart failure assessment and can guide treatment strategies with greater precision. Dual-gate Doppler in TDI-TDI mode enables precise evaluation of timing differences between the septal and lateral wall movements. This is particularly helpful for guiding biventricular pacemaker lead placement, ensuring optimal synchronization. The process is simple, quick, and suitable for routine clinical use. eTracking technology enables early detection of atherosclerosis by calculating arterial stiffness parameters in real time. The system automatically tracks vessel wall movement and measures diameter changes precisely using RF signals. Combined with wave intensity analysis, it evaluates how the heart and arterial system interact dynamically. Wave intensity analysis helps uncover hidden heart failure by measuring how pulse waves are reflected back to the heart from stiff arteries. When vessel walls lose elasticity, backward traveling waves accelerate, forcing the heart to work harder with each beat, even if ejection fraction appears normal. This insight is crucial for detecting early vascular dysfunction in aging or diseased arteries. With eTracking, vessel wall motion is automatically measured by setting a tracking gate on the B-mode image. The system provides micro-level accuracy and displays distension waveforms in real time. It calculates multiple vascular indices such as epinAC, offering detailed insight into vascular health. eTracking is applicable to both the carotid artery and abdominal aorta. These measurements help detect early vascular aging and arterial stiffness, crucial in evaluating cardiovascular risk, especially in hypertensive and diabetic patients. Wave intensity is a powerful hemodynamic index that quantifies the interaction between the heart and arterial system. It measures how pressure and velocity change over time at any point in the circulatory system. This allows for real-time assessment of cardiovascular performance, revealing how efficiently the heart and vessels work together to deliver blood. The magnitude of the first WI peak correlates strongly with the left ventricle's contractile performance, as measured by dP/dt. A second peak indicates the ventricle's ability to actively stop blood flow. These parameters offer critical insight into both systolic and diastolic function. eTracking with wave intensity helps evaluate ventricular arterial coupling, the relationship between myocardial contractility and arterial load. This parameter is increasingly recognized as a key marker in heart failure and hypertension. As left ventricular mass and contractility increase, often due to hypertension or volume overload, eTracking captures these changes early. WI analysis helps distinguish between adaptive remodeling and maladaptive stress, providing a more complete picture of patient status. Automated 2D tissue tracking, I2DTT, allows fast and precise quantification of myocardial strain and strain rate. The system measures global longitudinal strain, GLS, from apical views and calculates ejection fraction and radial strain with minimal user input. This is particularly helpful in identifying subclinical heart failure where EF appears normal. Two-dimensional tissue tracking automatically measures global longitudinal strain, a sensitive indicator of heart failure, even when ejection fraction appears normal. This is especially important in patients with heart failure with preserved ejection fraction, which accounts for over half of all cases. The system uses AI-driven pattern recognition for fast, reproducible results, with normal GLS values around -18%. Using I2DTT, GLS results are displayed with intuitive bullseye maps and trend graphs. This allows clinicians to track regional strain over time and identify subtle myocardial changes that may otherwise go undetected. In addition to strain, the system quantifies left ventricular volume and ejection fraction from 2D images. These values are derived automatically, supporting rapid assessment of systolic function, ideal for follow-up in heart failure or cardiotoxicity surveillance. This image gallery showcases the versatility of the Lisendo 880 leg in cardiac imaging. From standard B mode to color Doppler views, The system delivers high-resolution visualization of chamber structure, valve motion, and blood flow, supporting accurate assessment in both routine and complex cardiac cases. This advanced image gallery highlights the full spectrum of cardiac ultrasound capabilities, with the Lisendo 880 LE, from two-dimensional imaging and Doppler waveforms to dynamic color flow and 3D transesophageal echo. The system provides comprehensive visualization for structural and functional assessment, ensuring confidence in both diagnosis and intervention planning. This gallery demonstrates the Lisendo 880 LE's ability to capture high-resolution 2D and 3D transesophageal echo images, ideal for structural heart assessment. It also supports functional evaluation using strain, synchrony, and valvular analysis tools, delivering a complete picture of cardiac performance for diagnosis, planning, and follow-up. This slide showcases vascular imaging with excellent detail and Doppler sensitivity. From carotid artery plaques to peripheral vessels, the system delivers high-definition imaging for both screening and advanced vascular evaluations.